Today, we have an incredible set of experts joining us to share about access to crisis services for deaf communities, Olivia Stein and Steve Hamerdinger. Thrilled to have them both here for our episode, and really the feature and the theme of today's conversation. So I think we were going to share a video with you all in advance, but we're having some technical issues with the quality of that video. So I think if we can, we're going to drop it into the chat so you guys can take a look after we hop off today's Crisis Jam. But it really highlights the challenges of mental health access for individuals who are deaf and hard of hearing. And the importance of having accessible, culturally competent care. And I think that's a shared goal that we all have, and really an important effort to be focusing on as we do this work of building out the crisis continuum. So the video sets the stage nicely for today's conversation. So take a look afterwards. It specifically looks at Milwaukee County, but we know that those challenges exist across the country. All right, so let's jump in today. For those who don't know me, I'm Lindsay Browning. My pronouns are she, her, and I am the Director of Medicaid Programming at the National Association of Medicaid Directors. We are the nonprofit that represents the state Medicaid leaders, state and territory Medicaid leaders across the country. Folks, it can check out the Crisis Jam website, talk.crisisnow.com, to get the calendar appointment, to sign up for updates and reminders about these calls, and also to view all of those previous recordings. So bookmark that webpage and make sure you're taking advantage of the resources up there. Like I said, you can view previous recordings on there. You can download slides and other information. So really great resource. If the Crisis Jam disappeared from your calendar, I believe we're going to drop a link to how to add it back to your calendar in the chat. So you can click on that and download that. Next slide. As a reminder, again, all of the recordings are available, and here are the top 5 most viewed of all time. The Special Youth Edition continues to be the biggest hit. But I think we're going to give it a run for its money. Next week is the episode focused on the 1-year anniversary of the Crisis Jam, of 988, I'm sorry. So I expect we'll have really great turnout with Monica Johnson as the featured presentation to celebrate the 1-year anniversary of 988. Next slide. So we have a couple of news updates for this week. I wanted to share first a news story about Missouri's answer rate. They have achieved a 90% answer rate for the crisis line for the 988 calls coming in. So kudos to our colleagues in Missouri, and if your state's achieved that too, kudos to you all as well. Really just shows the commitment and work going into making the call lines accessible. Next slide. The other news item we wanted to flag is that AMA, the American Medical Association, released a new set of guidelines for offering integrated behavioral health care for older adults, which we know is so critical, again, to ensure access to care for older adults. So encourage you to check out those new guidelines. Next slide. And then finally, World Suicide Prevention Day is coming up on September 10th. And if you happen to be in New York City, there will be a celebration, an event happening there, and encourage you to check it out. And if you have events in your city or your area for World Suicide Prevention Day, feel free to share those with RI International, and we can feature those as well. Next slide. And then finally, the SAMHSA store, encourage folks to continue to check that out and order items and materials to continue to spread the word around 988. We know there are varying availabilities or time it takes to get certain products, but all incredible resources and products to promote the 988 resource. Next slide. All right, and as always, you can get your Crisis Jam merch, your Crisis Jam t-shirts from the website as well, from the Crisis Jam website, or you can sign up for trivia as always. Next slide. All right, so we are going to kick things off with our trivia question, and I'm going to invite Madonna Greer to join us. Madonna is in the hot seat today and is with the CIT International Board of Directors and NAMI of Guilford County. So Madonna, here is your question. In episode 110 of the Crisis Jam, Brian Bashan, who's the former CEO of San Francisco Lighthouse for the Blind, shared some considerations when working with the blind. Which of the following was not one of those considerations? No need to speak extra loud. Blindness is the most important factor in a crisis. Ensuring there are accessible forms, or use the words blind or low vision. So again, which one was not a consideration when working with the blind? And Madonna, you're welcome to phone a friend. And then we also, of course, invite folks to weigh in on the poll.
All right, great. Well, let's phone in a friend, my fellow board member, Sabrina Taylor.
All right, Sabrina and Madonna, what do you guys think? What's the right answer here?
I am trying to remember that episode. Madonna, what do you think?
I'm thinking A personally. How about you, Sabrina?
I was actually thinking B.
Okay. I could see that because we are focused on the crisis at the moment. So that sounds like a good choice. Shall we see what the audience says to help us decide?
I bet you they would know.
Oh, there was Sabrina.
Oh my gosh, you and me.
That's why I always phone my friend, right? So I am going to go with the audience of Sabrina and go with answer B.
All right, let's see what the answer is. And that is correct. So in that episode, Brian noted blindness is not a tragedy. There are 1.5 million blind Americans, just as common as dentists. Our blindness is not the most important factor when we're in crisis. So you guys were right. The answer there is B. Well done. And thank you for joining us for the hot seat.
Thank you for having me.
All right, so our quote of the day, continuing on that theme, and also from Brian, the quote from Brian is, "I've known thousands of blind people. Guess what? Blind people have crises just like everybody else or anybody else." And really that's, again, the theme of the conversation today is how to make services accessible to folks, recognizing that we all have mental health crises and we all need these services and supports to be available. The next slide. So I am pleased for today's feature presentation to turn it to Megan Haupt, who is the Chief of Staff at NASHPID, to introduce our incredible expert. So Megan.
Great. Thank you so much, Lindsay. I am so honored to introduce Steve Hamerdinger, who is the Director of the Office of Deaf Services for the Department of Mental Health for the state of Alabama, as well as Olivia Stein, who is with Deaf Lead and oversees video phone services for the Disaster Distress Helpline. I do want to say that how important it is that they're on, and also that we had a pre-meeting with these interpreters last week so that the interpreters would know Steve, know Olivia, know their key messages, know their styles. And so that kind of meeting is so important. Isn't it great if somebody is an interpreter for you, that they get a sense of a little bit about who you are? I want to note that when somebody is in crisis, they don't have that opportunity and they're in their worst moment. their worst day, and then frequently are put with an interpreter and sometimes not with an interpreter to try to understand where they're coming from. So, and often not trained. So I just want to bring that to light and have people recognize that importance of being familiar with an interpreter, and definitely having direct services is the best way, which Olivia will emphasize. So I'm going to hand it over to you, Steve. Thank you.
All right, thank you, Megan, for your introduction. You know, you already made many of the points for me. That was really great. I'll try to add some points to that. Please, next slide, please. And as mentioned during the beginning, the video from Milwaukee shows, you know, just how difficult it is to get services throughout the country, specifically for crisis services today. If a deaf person was in crisis, they have very limited options. If they wanted to reach out to 988, they see 988 everywhere. But let's say a deaf person wanted to reach 988. You have three options today. You could use text. Text is okay, but a lot of deaf people's English is not very good. They don't feel very comfortable with using English. Also, with text, you cannot see or hear the nuance and that makes a difference in how the counselor responds. So text is one option. Next, you can have a friend call for you, but where's the autonomy in that? Where's the ability for me to communicate for myself and to advocate for myself? Third is relay service. We know that we have at this time video relay service, and we can call any phone number that we wish, anywhere in the country, anywhere in the world for that matter. But the problem is you're still going through a third person, through an interpreter. Next slide, please. So what is video relay service? It is successful and it does help quite a bit. It's great to have. But as you can see in the picture, the bottom of the picture there, you can see how it basically operates. You have the interpreter in the middle, the deaf person signing, and the hearing person receiving the message. It's very much like what we're doing now. You're listening to Lee's voice, and he's saying what I'm signing. The challenge with having an interpreter is that you cannot see the actual caller. Today, you can see me and the interpreter, but on a 988 call, you wouldn't be able to do that. You wouldn't be able to see both of us. So that leads to the second challenge. The hearing person answers the phone, and it's not the voice of the person who's signing, it's a different person. So they're naturally going to wonder what's going on. And another important thing to remember is that Lee is speaking what I'm signing, but it's not the exact same thing that I'm signing. It's not a transliteration. It's literally an interpretation. So that means he has to make some judgments. And those decisions and judgments are influenced by Dr. Robin Dean. What she says, you'll see the next slide on those decisions that have to be made. Next slide, please. So Dr. Dean says, an interpreter must change the word choices. Lee and I have worked together and we have practiced. I have confidence in him in doing a good job, doing as best as he can. But Lee is not me, and I am not Lee. And we don't have the same mind. Lee will have to add and delete information as needed because ASL is a 3D language. And I can sign more information in just a few movements than he can voice. And so he may have to add some things here or delete some things at times. And so interpreters have to make decisions on what he sees that I actually mean. Good thing we were able to prepare before this, and so he knows what I'm planning to say and what I intend to say. But even then, you're listening to the interpreter's rendition or a view of what I'm saying. It's not exactly coming from me. So when a person calls 988, it becomes crucial to remember. And so one more thing before I forget. When a man, say for example, I'm a deaf man, I call 988, there is a high probability that the interpreter will be female. In fact, about 80% of interpreters working in the field are female. So a deaf man calling through the relay service will most likely have a female voice interpreting for him. So that adds to the confusion and the complexity. Next slide, please. An additional challenge is the interpreter interpreting for mental health. Mental health interpreting is different than general work that we do in the field, that they may do in the field. They may not have the training for mental health, and that's very important as well. And then the question is, do I trust the interpreter? The counselor will have to not only worry about developing rapport and trust with the deaf caller, but also the deaf person will have to trust the interpreter and the counselor both. So that complicates things. And lastly, can the counselor separate me from the interpreter? You can see both me and the interpreter on the screen. So it's easy for you to see that, Steve is signing and Lee is speaking for him. And so it's easier for you, but on the phone, that's a big challenge to really separate the two. You don't have that visual connection with the caller. Next slide. American Sign Language is the third most non-English language used in the United States. We don't have a direct line to call like Spanish speakers do. And several years ago, actually last year, sorry, NASBID asked a group of state directors of mental health to get together and make recommendations on how to improve access to crisis services. So we gave our recommendations, the three biggest recommendations. The first one, let's read the slide here. It says, NASBID recommends that one national call center be established for deaf people who are deaf and hard of hearing, who are primary users of American Sign Language. So it's an important recommendation, very important recommendation. We want to emphasize the need for effective communication and direct communication, just as Spanish speakers, veterans, LGBTQ, other groups have that connection and effective communication. And we have an effective model. And I want to turn over the presentation to Olivia at this point so that she can demonstrate how we can model how we can use the services, the recommendations that we mentioned.
Yes. Thank you, Steve. Okay. So as the director of the video crisis services for the deaf and hard of hearing, there has been a variety of services that have been offered. We have 2 different programs that are operating for hotlines. Both are operating as video phones. One of them is an effective model, which is this disaster distress helpline video phone. So we call it VA or DHHVP. And so this was set to be established by 2021, and it's been 2+ years since then now. And this is a direct service for on a 2-way platform, face-to-face, where we receive calls from a caller in the community who identifies as deaf or hard of hearing and is an ASL user. And they can call us and they're directly connected with a trained deaf ASL user who is, or someone who is fluent in ASL. And so it is 2-way, face-to-face. There is no third-party interpreter or anything else involved in the communication. It's full direct emotional support provision and direct communication. And so that platform is for people that have experienced disaster or trauma, human or nature caused, any sort of thing such as COVID, hurricanes, national disaster impacts, mass shootings, deaf and hard of hearing community members who have experienced things of that nature, stress and trauma, or any sort of situation where they need that immediate support and attention to express their concerns and their needs. Then they're able to chat with one of us directly, face-to-face, in their preferred language that they feel most comfortable with, which in this case is ASL, so we can see each other visually face-to-face as well. Next slide, please. So with this disaster distress helpline, we've been working on this for the last 2 years. And we've been using traditional hearing hotline models that are out there and trying to apply them to the video phone model. And language is the first thing when it comes to access. And what that looks like is what we were trying to figure out exactly, specifically. And what we identified is that having that direct language access is so much more effective for deaf and hard of hearing users who want to communicate in sign language. When they need to express their distress or emotions, having that video phone connection meets that need. Also, the visual engagement of that type of platform allows us to see, or both of us to be able to see each other's body language, and also acknowledge somebody's behavior and how that's connected to their emotions and how we can interact to better support them and identify their emotions. Because again, when it comes to ASL, American Sign Language, it's not only about what's happening on your hands and the signs, but it's also about what's happening on your body and your gestures and things of that nature. So if we want to better understand the caller, as opposed to using text messaging with them, there is a huge difference when we have that face-to-face direct interaction in ASL. Whereas with text, the emotions are often missing from the discourse. And sometimes people don't have a way to express that in text because English is not their first language. So when we can communicate with them directly in ASL, we can see their emotions physically and how their behavior is exhibiting those. Also, with hearing callers, the approach when the line first was established, we were getting a lot of calls from people who could hear, and we still do. And our best approach when that happens is not to use sign language necessarily, right? Because we feel like there could be a liability or a communication breakdown. So what we do is on the platform, we have built in a text feature so we can provide appropriate referrals for the person to call in where they need to align with people that can hear and speak, and so that they're able to use their primary language, or if they prefer to use texting back and forth, that's another option for them as well. So the crisis counselors that work for us work in a space where, I mean, that was another challenge that we had to face, is how do we make a professional visual approach for what callers would see, what our appearance looks like, what we're wearing, how we show that we're attentive. And so the clothes that we wear must be solid, and because otherwise it could be visually distracting if there's like some loud patterns going on. We also need to make sure that we have a solid color background that is also opposing our skin color, so contrasting our skin color as well as our shirts. So what we've found in testing of the project with deaf and deaf-blind callers, we've been gathering a lot of information about what works for deaf-blind callers as well as for deaf callers. And we found that deaf-blind callers have slightly different needs. And so we are trying to accommodate as many people as possible with the choices we make as far as visual accommodations. And so when we talk about this visual and voice compare and contrast, we want to make sure people understand what we need. Like, we've done some analyses on a couple assessments for suicides, and we know that in the past, one of the questions that's often used is, in the past few days, have you thought about suicide? And then also another question is, have you done anything to try to harm yourself or kill yourself in the last few days? But with people whose primary language is ASL versus people that can hear, the assessment is a little different. We use a more casual approach with the questions because suicide is a very taboo topic in the deaf community, and it has a lot of stigma attached to it. It's a very sensitive topic. Many people don't feel comfortable if we address it in the typical type of conversation that would normally happen on a regular hotline. So it's better to kind of just engage with the person, find out what kind of situation they're in, and then let it naturally lead to possibly asking one of those questions in the most casual way possible, as opposed to just directly coming out and asking that question, right? So we're talking about many approaches that we're using, body language, eye gaze, facial expression, how we can best show compassion and empathy, and how we can have them see that we are there for them. And it's important that our body movement and eye movement and all of that language shows that and is mirroring what we're trying to get across as well. Next slide. So I will show you all this video of what our crisis counselors and our platforms looks like and what the counselors see. You'll see what a counselor looks like when they're sitting ready to receive calls, and what the answer process looks like as well. You'll also see what the text feature in the platform looks like. That will give you a little bit of an idea. And then we will move through the video and show you some various methods of how callers can reach out to us on the platform. And we'll show you, there's a couple methods too, specifically that we'll show you for that. All right, you can go ahead and start the video. Okay, first is the crisis counselor's view. when we're on shift, this is what we see on the platform. We see a call ringing in. So we answer the call. We can see each other. You see me on both ends in this particular demo. And then you see the text feature below. So, hello, you've reached out to DHHVP. And the text feature provides some other options for callers who feel more comfortable using text, especially for those who are deafblind. And now you will see two different methods for people to call in. First one is on SAMHSA's ASL FAQ page. There's a link for DHHVP, and you can click that button and it will connect directly with so the caller is directly connected with us in the call center. What they'll see first is the wait message, the hold message saying, hey, thanks for reaching out. You can see the person is communicating in sign language saying we're available 24/7. So you see they're saying, please wait while we connect you to the next available crisis counselor. And now it's connected. The crisis counselor is saying, hello, thank you for reaching out. Let you know, this is just a test, but we're just exhibiting the face-to-face platform and the fact that both of us are able to use sign language to communicate. So it's two-way access. And here's the second method through VRS on the video phone. So someone can dial the phone number for our center and reach us directly, and they'll see the same queue message they saw if they used the ASL Now button on SAMHSA's website. And this is another VRS option to use. There are so many different types of VRS services that are out there that callers have that they can use to call into our center. So this is what our platform looks like. And now I will hand it back to Steve. Thank you.
All right, thank you, Olivia. That's really impressive, the technology that you just demonstrated. And that's what the committee has been able to establish. Last two recommendations from NASHBID. The call center that has been established is also a database collecting information on how states can follow up and on how to make contacts. Last recommendation is each state has someone in place or in position. For example, in my state, the director of deaf mental health services for deaf people is only about 8 to 12, depending on how you count, how you define the duties. There's about 8 states that have a full-time coordinator for deaf services. And so we really need to expand that number to help the National Crisis Call Center provide the best services possible. And so I want to thank you for paying attention to my presentation, and I want to turn it over to Megan again.
Steve and Olivia, what a powerful presentation. Very impressive. You may see some of the chat pieces. I'm going to turn this over to the round table. And if each of you could just give your thoughts and perspectives for 2 minutes. Can you, we're going to go with Ivy Velez first, who is from Massachusetts and a Latina advocate, as well as a statewide deaf coordinator for Massachusetts. Ivy, for 2 minutes, please let us know your thoughts and comments.
Okay, well, those two speakers were wonderful. I totally agree with what Steve said about the lack of resources for deaf and hard of hearing people. And that is such a nationwide issue. It's a barrier everywhere. It's not one specific state, it's the whole country. There is such a lack of services and resources. It's systemic. And also, I really appreciate what Olivia said. It was very clear to be able to see that model and the demonstration. And that's the dream. I wish my state, Massachusetts, the statewide coordinating office for the deaf and hard of hearing, you know, when working with children and mental health issues, often what happens is they're stuck in the emergency room for many hours without an interpreter, if it's a weekend or whatnot. There's so many issues system-wide, especially for children with mental health challenges. There's nothing. There are no resources. And so what that does is makes crises way worse, and they just keep escalating. If people felt they had support to be able to express their, you know, what they're feeling, it would be such a game changer. And so in order to have a national call center, I mean, we should have been having this for a long time. Why did it take until 2023 to make this finally happen? We're so far behind on all of this. People have not been able to express themselves for so long. And interpreters are the key in order to providing a voice to all of these people who have historically been oppressed and not able to express. And so having this bridge for communication, you know, we rely on interpreters every day. And sometimes, you know, Steve mentioned about the male female thing. And as a woman who uses sign language, sometimes I get an interpreter who's male or female, and it can be very confusing to people when I'm making a relay call. They don't understand what's happening and why the voice doesn't necessarily match the caller. And so sometimes I will ask, like, hey, have you experienced an interpreted call before? And then sometimes I'll have to provide education about what's going on out there. But so many people are not trained and have no experience and have no idea how to work with us. And that can just make a crisis so much worse. It can escalate it, you know, 4, 5, 6 times worse. It just creates so many more barriers for our community. We've been hidden, we've been ignored, we've been oppressed, we've been kept silent. And as a deaf person, if I'm walking along and somebody doesn't know I'm deaf, maybe they'll reach out or something, you know, they don't realize I'm not responding to them because I'm deaf, right? And so I've been kept silent, and I'd like to hear your thoughts.
Ivy, thank you so much. You're really bringing in such an important perspective, especially around being ignored, being silenced. The deaf community has historically been invisible. And one of the things we really want to bring forth is equity. When we're talking about equity, we're talking about everybody. And sometimes we need to remember everybody. And so thank you very, very much. I'm going to introduce Kelly Sterling, who is a statewide coordinator for the Department of Behavioral Health and Developmental Disabilities for the state of Georgia. And Georgia does a great job. Kelly, please let us know your perspective for we just had a little short on time. So just for about 2 minutes.
Thank you. Good afternoon, everyone. I'm a CODA, child of deaf adults, and through my perspective and experience, I can share what I've seen and experienced. As a hearing person, I can sign with those who I work with here in Georgia. But those who are thinking after this presentation, you know, the leaders for 988 system, we're looking at how we can standardize this nationwide, various states, and make this culturally competent. The same way other languages, spoken languages users have access. It's an important consideration that's being brought up today and emphasized again. Interpreters are with us here today it's not a crisis, but still we're able to get the message out through them. And it's very important having skilled interpreters, and also important to consider the deaf individuals who are experts, who know how to work with interpreters and the content. And but it's not the same. We shouldn't assume that it's the same for 988 crisis calls. So we're getting the messages from one of our signing therapists, and she just said that this is why ASL interpreters, it doesn't matter, even if it's the same interpreter, our clients, you know, need to benefit from the services we provide. I believe that we all here today stand together and envision the day where everyone in our country has access to a level of care in the language that they needed to be in. And whether if a deaf community has someone call, there's going to be someone to respond, and a safe place to go for emergency care, and not just for basic care, but something that is a full care, if you will, comprehensive care. And that would lead, you know, to a signing a helper who could help in sign language in their community, who they can partner with. And just last week here in Georgia, we held our first deaf certified addiction recovery specialist, CAR. CARES is what the acronym is, and it was a really great helped build the system of recovery for peers of our deaf community here. And we need this at the national, state level, leaders to cause this vision to happen. We here in Georgia are very thankful for our past leadership and current leadership to make this happen. So we thank you all for your attention on this today, because it's a very critical issue. Thank you very much.
Kelly, thank you so much, and for your excellent work in Georgia, and Ivy, you too, for your excellent work in Massachusetts. Steve and Olivia, just really fantastic. All of you, just great leaders. So thank you so much. I'm going to turn this back to Lindsay Browning, and thank you all.
Let me echo that. Thanks. Really just appreciate the perspective and importance of direct access to mental health services in ASL. And I know this is going to continue to be front and center in our work together as a community. So let's turn to our standing updates, and we're a little short on time, so I'm going to ask folks to keep it brief. But James, I'll turn it to you for our SAMHSA update first.
Yeah, thank you, and really appreciate the presentations beforehand. I think it speaks to the heart of equity and access of 988. And so a few things that I wanted to just share quickly. I was going to go over an update on a process that we're working on our interactive voice recording to improve. I'll go ahead and save that for another time. But we are excited that the LGBTQI youth service has fully transitioned to our sub network. That's from the original Press 3 pilot, which expanded both workforce and centers providing services for the LGBTQI youth population in phone, chat, and text. That has been complete through our Press 3 and our chat and our text services. We've also, again, just heard the critical need for access across populations, and very excited for two populations working on. I'll start with the first, which is Spanish chat and text, which we are looking at activating those services this month. So we are on track for that, and please look out for more information through communications, SAMHSA Communications Comms, and Vibrant, our network administrator. And then finally, obviously, the critical need to expand our services for those that are deaf and hard of hearing and supporting the community in the way that really speaks to how they will use and access services to meet their individual needs, which feedback we don't get relay requests for the Lifeline. It is rare. It's not the preferred modality, and preferred modality showing through DDH is video phone-based services. And so an RFP did go out for our centers to be able to provide that service this year. And we are on track to activate 988 video phone-based services for the deaf and hearing population this year. So more to come on that, but just wanted to make sure that individuals were aware that it is just a critical priority for SAMHSA to make sure all populations do have access, and we'll continue looking for ways to expand the service. So thank you.
All right, thank you, James. Next, I want to turn it to Brian for our NASHPIT update. So Brian?
Yeah, just real quickly, and then I'll turn it over to Megan. I wanted to bring people's attention to the governor's playbook on improving youth mental health, which is going to be presented at the National Governors Association meeting next week in Atlantic City. And the issue of youth mental health crisis is on the agenda for all of the governors. And they've put together a playbook with 35 nonpartisan policy recommendations, which are going to be shared, including prioritizing early screening and interventions, and investing in mobile response teams, expanding mental health education and school curriculums, teaching children life skills that build resiliency, expanding the mental health workforce. Governor Murphy, who is the chair of the National Governors Association this year, has said, I don't want to lie to you, most of this stuff doesn't come free or cheap, but the solutions exist, they're within our reach. And so I wanted to highlight that, and let me turn it over to Megan.
Thank you so much, Brian. We've got some questions in the chat box about peer support for the deaf and hard of hearing community. And I just wanted to emphasize that any kind of training for deaf and hard of hearing and peer support, just like the 988 line, should be direct, that it is a best practice to have the training be entirely deaf and not like a mixed hearing and deaf group. So it's just so much better to have direct services all across any kind of deaf services. And just really thrilled for SAMHSA's leadership in putting out the RFP for video phone services for deaf and hard of hearing.
Great, thanks, Megan. Thanks, Brian. I want to turn now to our crisis talk, and Stephanie Hepburn, I'll allow you to introduce your expert with this week's crisis talk.
Thanks, Lindsay. So yeah, I'm very excited to welcome Dr. Swasumolo Soyinka. He's the Chief Medical Officer at Philadelphia's Department of Behavioral Health and Intellectual Disability Services. When we chatted, he shared with me that one of the most troublesome forms of mental health stigma in the U.S. is the persistent disparity in healthcare funding. Dr. Soyinka, can you talk a bit about what funding model could actually help counter it?
Absolutely, and thank you, Stephanie, for the opportunity, for the invite to be here this afternoon. Really enjoyed the discussion so far. Yes, one opportunity I think, particularly now as this crisis transformation is being set up, is to think about a prospective funding model. Now, an example of how this has been set up and made operational is the way that CCBHCs are funded. So essentially what this means is, instead of requiring that providers essentially get reimbursed for services after they've been delivered, it's really what it is a prospective payment that says we are allocating this sum of money to a specific provider to serve a designated population. One of the advantages of a prospective payment model like that is that my apologies. It seems I have a video problem. Please
Yes,
bear with
no
my
problem.
apologies. Yeah. So one of the advantages of a prospective payment model is that it uncouples, it allows the services to be provided that historically may not have been have been reimbursed. For example, I think most of us know that within behavioral health in general, and more so within the crisis space, there are a multitude of services that cannot be or that are not reimbursed currently that are absolutely essential. One example is care coordination. And so that sort of prospective payment framework covers those services potentially. I'll say one more thing about this. It's also the opportunity to really set up a value-based reimbursement framework. So when that sort of funding is tied to specific outcomes, designated outcomes, then it really means that it really drives the providers of care towards quality rather than just quantity, which is one of the unfortunate shortcomings of the fee-for-service system.
Thank you so much. You mentioned as the community behavioral health clinic movement, this is a certified community behavioral health clinic movement, as they become more mature, you talked a little bit about what the benefits will be. And I think part of that is going back to that value base. But if you don't mind fleshing out a little bit about those specific outcomes, I think that would be helpful.
Yes. So I will, in order to better understand that, I think one framework to look at is how we define success. And I'll just use this as an opportunity to plug a paper that a group of colleagues working under the National Council have worked very hard to develop. It's the crisis metrics paper that was put together by the Medical Director Institute. I just posted that in the chat, but essentially what it means is driving towards specific outcomes such as time to accessing a physician or a clinician when an individual gets to the crisis response center, crisis receiving center. How long does it take for them to see a physician or a clinician, which itself is a sort of a proxy measure for how efficiently those services are being delivered. So that's just one example. There are many others like that. Another metric apropos to our discussion today would be outcomes for minority populations as compared with majority populations, and sort of tracking what those look like over time would be important measures of equity.
I love that. Thank you so much for hopping on the call, and I'll pass it back to you, Lindsay.
Wonderful. Thank you both so much. I'm going to move us now to our federal update. I know it's been a couple of weeks since we've had one. So Joanna, I'm going to turn it first to you, and then we'll hear from Sarah as well. So we'd love to hear what's happening at the federal level.
Thanks, Lindsay. So we haven't had many updates recently because Congress is really focused on FY24 and appropriations, and that's sort of waylaying the 988 discussions that we've been excited to see over the last session previously. We did get some news that Representative Cardenas's office is working on a new version of the 988 Implementation Act, which we're really excited to see reintroduced. Hopefully over the next couple of months, we'll keep you all updated. It's a revised version that sort of takes out pieces that did pass in other packages of legislation last session. So as we get more information, we'll share with you all. Sarah, I think, is not going to be sharing anything right now. This is the only update that we have so far. Things are moving slowly at the federal level, but we appreciate you all bearing with us. So Lindsay, I'll pass it back to you, and thanks so much.
Great. Thank you so much, Joanna. All right. Moving from the federal level to the states, want to hear from Shelley about what's happening, the movement at the state level around 988.
Yeah, thank you, Lindsay. So session has been closing up for several states now. And last Friday, in a bipartisan vote, the Delaware legislators passed HB 160, which includes a 60 cents telecom fee. Right now, it is sitting at the governor's desk, and if once signed, Delaware will become the 8th state with the 988 fee, and it will be the highest in the country. So that's it for today.
Thank you so much. As we come to the top of the hour, I want to leave you all with a couple of reminders. The first is that you can check out Moving America Solo and Suicide. Those videos are incredible. The QR code here is to the official trailer. So check it out, share with your friends, share with your colleagues. Next slide. And then just want to remind folks, again, here's the YouTube QR code to be able to access the various episodes themselves. And I know we've featured some of the individuals on the Crisis Jam before, and really just incredible stories. Next slide. All right, and the final reminder that next week, be sure to clear your calendars and join us for the Crisis Jam as we celebrate 988 turning 1. Monica Johnson will be joining us for that celebration, and we hope to have the highest viewership yet for that episode. And then the following week, join us to hear from Charlotte Claiborne, who leads the Bridge Center for Hope in Baton Rouge, Louisiana. So it'll be a great conversation as well. So with that, thank you guys so much for tuning in. I hope you have a great rest of your Wednesday, and we'll see you back here, same time, same place next week for the Crisis Jam.